12. Accepting. After becoming prepared to face, the next step is acceptance. And as acceptance is the key to recovery, we should be sure of its meaning. Acceptance means letting the body loosen as much as possible and then going toward, not withdrawing from, the feared symptoms, the feared experiences. It means letting go, going with, bending like the willow before the wind, rolling with the punches. When one goes forward this way into panic, into any of the feared symptoms, the secretion of the hormones, principally adrenaline, producing the symptoms is reduced. Even if only slightly, it is reduced. On the other hand, tense withdrawal encourages further secretion and so more sensitization, and therefore more intense symptoms. While at first acceptance of physical symptoms, especially panic, may seem impossible, practicing thinking about acceptance is always possible, and this alone can release some tension, although perhaps only a microscopic amount to begin with, so that when it comes to do its worst, the worst is tempered. If you stand taut and say bravely with clenched teeth, "Come and do your worst, but get it over quickly," you are only putting up with. A patient will complain that he has accepted, but that the dreaded symptoms are still there. "I've accepted the churning in my stomach, but I still have it, so what do I do now?" How could he have accepted while he still complained about it? The most frightening symptom is panic because in a sensitized person, it can strike so fiercely and so quickly, merely thinking about it apprehensively can bring it on. The natural reaction is to recoil. However, tension brings more sensitization and so more panic. Acceptance is a definite psychological process that eventually soothes. I say eventually because the soothing can rarely be felt immediately. Acceptance is the beginning. Established sensitization can rarely be soothed quickly because it takes time for the new mood of acceptance to be felt as peace. Although the symptoms of nervous illness are always the expression of mood, they are not always an expression of the present mood. When acceptance is first practiced, the body may still be registering the tense, frightened mood of the preceding weeks, months, years, and may continue to do this, but with progressively reduced intensity, even after the mood of acceptance is established. This is why nervous illness can be so puzzling. A nervously ill person may begin to accept, but when the symptoms do not quickly disappear, he loses heart and becomes apprehensive once more, although trying to convince himself that he is still accepting. I repeat, it takes time for a body to establish acceptance and for this to bring peace, just as it takes time for fear to be established as continuous tension and anxiety. This is why letting time pass, the last of my 4 concepts, is so important in treatment. Understanding makes acceptance so much easier. It is unnecessarily difficult to accept erratic heartbeats if the victim believes that her heart is diseased. How much easier when she understands that the unevenness of those beats is no more than a temporary and unimportant upset in their nervous timing. Adequate explanation is indeed a boon to the patient preparing to accept. However, it is not always given. One woman said, "I can't describe how I feel, I just feel funny. The doctors just look at me and give no explanation." Feeling funny can be an accurate description of how a nervously ill person does sometimes feel, and describing her funny symptoms can be difficult, because symptoms of fatigue and anxiety when working together can be vague, undefined, and vague symptoms can be just as upsetting as more definite ones. If you feel like this, providing your doctor has examined you and said that your funny symptoms are nervous, accept them and be comforted to know that funny feelings are common in nervous illness and never important. Blind acceptance can cure as well as acceptance based on knowledge. But when knowledge guides, acceptance is easier. Some doctors, while knowing that funny symptoms are nervous, do not understand their physiology and so cannot explain them. So while funny nervous feelings should be accepted without full explanation, if none is available, explanation of more definite symptoms, weakness, trembling headache, palpitations, difficulty in swallowing and so on, should be sought. I explain these in detail later in the book. Don't think I use the word acceptance lightly. I know what I am asking. It is not easy to accept the fire that consumes, not easy to work with the fire burning. It's not easy to accept and work with a body that feels as if it's vibrating, shaking, with stomach churning, limbs aching, heart pounding, sight blurred, head swimming. I'm making it sound terrible, aren't I? It can be terrible, and it is made worse if the mind, at the same time, feels as if it is drawn out into a frail thread that will snap with the slightest extra tension. I understand all this, but I still preach acceptance. One day, a woman phoned to say that that morning had been especially rough for her. She'd come through by saying to herself, "I'll be talking to Dr. Weeks in a couple of hours. I'll have some peace then." The thought of the peace to come sustained her, but living for such peaceful moments was not good enough. It meant that she would still make little progress. There is no lasting peace in waiting for someone else to bring it. Such relief from suffering is only a respite. I explained to this woman that peace lay within herself and depended on her attitude when the symptoms were at their fiercest, and that was the moment for her to practice the acceptance that would help her find lasting peace. She thought for a while and then said, "You mean I have to find the eye of the hurricane?" She had the message at last. Sailors say that at the center of the hurricane there is a place of peace which they call the eye. The storm swirls around but cannot reach it. To find it, the ship must first go through the storm. If that woman were to work as willingly as possible, accepting the symptoms, the hurricane, and not add second fear, she would find the eye of the storm herself. And although the symptoms may at first seem as fierce as ever, there would be some peace and reassurance in knowing that she was on the right course at last, without having to wait for the doctor's soothing words. Peace of mind built on earned confidence lies not in the absence of symptoms, but in their midst. And it is only when one discovers this that the intensity of symptoms abates and there is peace. The process, of course, is gradual. The next day, the woman reported that while feeling ghastly, she had sat at her work. She was an artist and had painted for 2 hours. For the first time in months, she was able to lose herself in work, while the hurricane raged within. For once, the hurricane did not seem so important. It takes courage to face the storm and let happen what will. That woman had been shrinking away from the way she felt for 20 years and was still ill. Surely it was time she tried another approach. Tried to go into the storm, accepting it willingly. Well, as willingly as she could manage at first. Many are helped by understanding that the flash of panic is no more than an electrical discharge, that while it may feel devastating, it is only an electrical discharge along sensory nerves. So many people allow an electric flash to spoil their lives by withdrawing from it in fear. As I have explained often, fearful withdrawal produces the hormones that stoke the fire of panic. Facing and relaxing toward with acceptance help to dampen the flow and eventually stop it. A sensitized, bewildered person, feeling his panic grow stronger as his sensitization increases, may imagine being flooded by an irresistible tidal wave of panic. If he analyzes his fiercest flash, the flash he thinks too fierce to bear, he will find that at its peak he is shudderingly withdrawing from it. Whenever he fears panic, he can eventually quell it only by going forward into it, never by withdrawing from it. A person sustained by this knowledge will one day be surprised by feeling panic sweep over him and yet feel aloof from it, as if looking down on it. He has lost his fear of panic. We talk about rising above a situation. There is no better example. When there is no longer fear of panic, it gradually subsides. Time becomes the healer. I stress again and again that cure lies in losing fear, and that this is earned only by learning how to go through it the right way, with acceptance. With such understanding, it is possible to be cured immediately. I have seen this, but of course, rarely. Repeated panics can be exhausting. This is when I advise moderate and temporary drug therapy and an occasional rest to help the sufferer regain strength and refresh his spirit. Medication must always be planned so that the sufferer still earns his inner supporting voice, born from having faced and accepted. I talk so much about panic because I am using it as an example from a hierarchy of nervous symptoms: palpitations, churning stomach, trembling hands, and so on. When the sufferer learns to accept these without adding second fear, they also gradually subside. They must, because they too are the symptoms of fear. You may ask, but what if a nervously ill person is kept constantly stressed, perhaps frightened, by some problem, perhaps an upsetting domestic situation that is difficult to change? How can accepting the nervous symptoms help him. It can't solve the problem. It can't. However, people who develop nervous symptoms because of the stress brought by a problem can also be further upset by the symptoms themselves. The iron band headache, extreme fatigue, quickly beating heart, sweating hands, and so on. Understanding the nature of these symptoms helps lessen fear of them, and so gives greater opportunity to concentrate on trying to solve any problem. If you are listening to this because you are nervously ill, I want you to practice acceptance now. Make yourself comfortable. Take a deep breath. Let it out slowly. Let your tummy muscles sag. Give way, and try to feel a willingness to accept.